As MBBS students, there are many things which we don't get to see. We don't get to see open heart surgeries, complex neurosurgery, triaging, or get our hands in many areas such as plastering, ODs and more, unless it's your elective. For the past 2 weeks, I had the chance to read EEGs, spent time at the ICUs, did my nerve conduction studies, taught students, and saw patients getting seizures. And that's all because I had my neurology electives. The past 2 weeks were probably the best days of my MBBS. So what's an elective? In 2019, NMC rolled out the new CPNE-based, competency-based medical education, and yes, I belong to the first batch of students. One of the major changes is the introduction of electives for the first time for MBBS students after they found 3 phase 1 examinations. During your electives, you can choose to spend time and gain experience in 2 departments, one clinical department and one non-clinical department for a span of 2 weeks each. I chose neurology as my clinical elective and I chose physiology as my non-clinical elective. So how is it different from the usual day? Well, if you're not a medical student, this is how a typical day goes like. You have your clinical postings in the morning hours for 3 hours in different departments throughout there. This is where you get to interact with patients, take cases, see surgeries in the operation theatres and much more. During the afternoon hours, we have theory classes and by 4 p.m. our day usually ends in the college. During electives on the other hand, there is none of these stuff. We have a set of objectives which we need to be completed within the 2 weeks. There are no presentations, no examinations and certainly no lectures. It's a more hands-on based experience. Also we get the chance to get exposed to many things which we don't usually get. For example, during MBBS days, there is very little exposure to super specialty departments like cardiology, cardiovascular, thoracic surgery or neurosurgery. But electives gives you a wonderful chance to explore these departments and see how they function on a day-to-day basis. So how did the electives go? Well, I chose neurology as my clinical elective and there are 2 reasons for that. Firstly, I feel that I'm more of a medical guy than a surgical guy, so I choose a medical specialty like neurology. Secondly, the more important reason is that I wanted to get an exposure to a super specialty department. As my objective, I had the topic of seizures and electroencephalogram. If you don't know what EEG or electroencephalogram is, it is basically the electrical recording of the brain, just like an ECG. EEG is to the brain what ECG is to the heart. When we opted for neurology and there were 10 of us, we actually thought that no one would really care for us in the department because after all, we are just final MBBS students. We seem too premature for the neurology department. But to our surprise, the entire department came to receive us and we received a warm welcome from the head of department. We were also really excited in a sense that it was their first time seeing the MBBS students after such a long time and they wanted to give their best to us. We were divided into groups of 3 and I have to say that all the faculties which were assigned to us were incredibly friendly and supportive. They taught us the department and they also made sure that we did the work which we were supposed to do. Being a part of team of 3, we spent our time learning how to read an EEG, which is not something that we learned during our MBBS days. We also learned about the latest classification of seizures, the different kinds of seizures, and most importantly, the first aid measures which has to be taken when a seizure episode happens. Apart from this, we also had to take the role of a teacher. After all, every doctor is a teacher. We had the opportunity to educate the general public and the bystanders who had come to our college regarding the first aid measures to be taken during a seizure episode. We also got the chance to teach the diploma students about neuroanatomy, which we had learned during our first MBBS days. One thing which I found interesting here in neurology is that the way they approach a case of stroke, which is cerebrovascular accident, is very different than what we are taught in medicine during our MBBS days. That's about neurology, but what about others? Everyone I knew really enjoyed electives in their own way, especially those who got exposed into the surgical departments. Some of my friends saw open heart surgeries, others got exposed to plastic surgeries and even neurosurgery. There are friends of mine who worked in triages, did CPR on patients, and got lessons of advanced cardiac life supporters, did plastering, suturing and much more. And the best part about the electives was no lectures, no academic stress, and no examinations. What are the insights here? I gained a lot of insight being with the professors for the past 2 weeks. One of the biggest experiences for a medical student is listening to the stories which our professors tell us and imbibing the wisdom from that. These are the things which you can't find from your textbooks. My HOD shared some valuable advice which he believes to be homeschool, and I would like to share 3 important insights. First one is regarding the importance of clinical postings. Our HOD told us that it may take up to about 15 years to finally realize why we went to a clinical posting during our MBBS years. Oftentimes we as medical students, when we go through a clinical posting, we often question why are we actually going through this? It seems to be useless, or this department is for PCs, it's not useful for UGs anyway. But my HOD shared a story on how his cardiology postings which he had during his MBBS days turned out to be super valuable later in his life. The second is the story of one of my neurology professors who was once an orthopedician who then shifted to neurology. Now, if you do not know how different these two specialties are, orthopedics is a surgical specialty, whereas neurology is a medical specialty, and they are like two ends of two spectrum. Often as medical students, which specialty has scope is something that we often think of, like, in what branch should I do PG? But my neurology professor gave me the answer. The scope is on you and not on the specialty. You don't have to take a specialty which you are not at all interested and stick with it for the rest of your life just because it has scope. And the most valuable advice which I got is regarding quitting medicine. I want to quit medicine. MBBS all medical students unanimously agree that we all wanted to give up medicine during our journey. And often as medical students, I find that a lot of times we are pessimistic about medicine. And this is the exact moment where Maheshwari said this interesting thing that he is going to retire this year. And even though there have been lots of different times during his career where he wanted to quit medicine and do something else, he said that at this point in life where his career is almost over, if he had a chance to go back and rethink his life choices, he would still be a doctor. That's something I guess, and all of us, especially when we feel pessimistic about medicine, this is exactly what we want to hear. When it comes to the negative part about electives, there actually quite isn't much. However, what I would like to suggest is that if NMC did allow us to complete our electives in a different college, that would actually be a good learning experience. Many countries abroad provide this experience, and that's one change which I would like to see about the electives. Secondly, at present, the clinical electives take up the whole day, which I think is not necessary. For the most part, most of our work gets done by the afternoon, so the electives time duration can be shortened, like it could start from the morning till afternoon till 1 p.m. I guess that's enough. So that's for this video. Follow my channel for more medical tips and videos. Thank you for watching and see you soon in the next video.